Hello, thank you so much for having me. So, what I like to do is I like to introduce myself as a face of socialized medicine. I lived it, I breathed it, and I survived it. But the reason I survived it is I came to the United States for treatment. A little bit of an idea of what happened to me, and I am just one of thousands and thousands of stories. What happened to me was I started to get all sorts of strange symptoms, and the most disturbing one to me was that I started to lose my vision. I called up my local optometrist, who is one of those doctors that the government hasn't taken control over yet. And so I was able to make an appointment for myself and go in and see him immediately. He was a friend of 30 years, and he sat me down and did all the testing, and he knew right away what my problem was. The pattern of blindness that I had started to develop had shown that there was a tumor pressing on my optic nerves. So I didn't panic because, again, I am one of these lucky Canadians also that still has a family doctor. Many of us do not. So I went to my family doctor, again, first name basis, and we sat down and we laid it all out on the table, what needed to be done. And, the standard stuff. I needed an MRI, and I needed to see a neurologist and an endocrinologist, and I needed to see them immediately. She got on the phone, and that's when the shock set in. It was going to be 19 weeks for me to get an MRI, and it was going to be 4 and 6 months to see the other specialists. And those specialists were in 2 different hospitals in 2 different cities, 2 hours apart. So I kind of hung my head down and went home and wasn't quite sure what I was going to do. Sat down, spoke to my husband, and as luck would have it, an American friend of mine called me that night because he had been concerned on how I was feeling. And I explained to him what the situation was, and he said, "You know what, Shona, this is crazy. You need to see another doctor." And I said, "Well, in Canada, we can't do that. We can't just pick up a phone and phone a doctor or a hospital or reach out to get that kind of help." Now, this is the most embarrassing part of my story, because my whole life I had been raised on how horrific the American healthcare system was. But that night I realized that I was so desperate that I would even try the American healthcare system. I have since taken my words back. I traveled to the US. I contacted 3 different hospitals. Those hospitals had me send them information. They all decided that I needed to see someone right away, and they worked with me on which facility would be the best to treat my type of condition. I traveled to the US, and the second part of the embarrassing part of my story is when I walked into this hospital, the feeling of relief that came over me because 2 of my doctors were Canadian doctors. So I thought, well, at least I have Canadian doctors, but they too had fled the the Canadian system just to be able to do their job. They ran all the tests I needed, and within a couple of days I had a full diagnosis. I contacted my husband to come into the office, and he said that your wife needs surgery and it needs to be immediately. My husband said, "Can you define immediately? Because, now that we have a diagnosis, we have an appointment in September." And he put down his pen and he said, "Unfortunately, your wife will no longer be with us by then." That's kind of when it hit home. And I think he saw the panic on our face, and he said, "Trust me, because like everybody else, we believe that if you're sick enough in Canada, they will take care of you." He made every phone call he could to every contact he had in the city that I lived in. He could not get me in either. But being the stubborn Canadian that I am, I went home and I thought, I can advocate for myself. I can do this. I want to be home with my husband and my parents and my children, where everybody wants to be when they're facing brain surgery. I couldn't get in any door whatsoever. Within 2 weeks, I returned back to the US and I had my surgery, which is what's made me be able to stand up here and I can see you as much as you can see me. So at that point, I vowed that I would speak to every Canadian and American that would listen to me about the differences between Canadian and American healthcare system. The irony of my story is I can get an MRI for my dog tomorrow. I can get a hip replacement by next week for my dog. I can buy health insurance for my dog. But my husband, who needs a knee replacement, will wait a year and a half. Any organization, if I treated an animal like this, they would take the animal from me and charge me with animal cruelty. Once the government becomes involved in between you and your doctor, they take away any option and choices that you have. Now, a lot of people have criticized what I've done, and the biggest criticism to me is that, well, you had the money to do this. You're one of the rich ones. And again, I have had to come out and tell the world about my medical conditions, but I've also had to tell everybody about my financial conditions. My husband put a second mortgage on our home, and he works 2 full-time jobs. And someday the medical bills will be paid. We know it will, because we got the services that we needed. But I represent average Canadians. We are insured, we have coverage, but that doesn't mean that you can get in and see a doctor. So here I am, telling my story. What is my skin in the game? Absolutely nothing. I don't even have a vote. But I'm here to say that my fear is that if this healthcare stays the way it is with this healthcare bill, I don't know where Canadians are going to run to for treatment. But more importantly than that, I really don't know where Americans will turn to. Unfortunately, Canada has not been able to reciprocate the type of treatment that you get when we come over the border here for help. So what I ask is stay engaged in the healthcare debate. This is the last stab at it. If this isn't overturned, it's like unscrambling an egg. It's near impossible once it's pushed through. So thank you.